Good afternoon, everyone. This is Dr. Val Arkush. Welcome to our Wednesday press briefing. Today is December the 23rd. We are in week 42 of the COVID-19 pandemic here in Montgomery County, and pleased to be here this afternoon with my colleague, Commissioner Ken Lawrence. So today we have some exceptionally good news. This morning, our Office of Public Health took delivery of 2,000 doses of the Moderna vaccine. Finally, after 42 weeks, we can now go on the offense against this virus instead of only playing defense. These first doses will be used early next week to vaccinate paramedics and EMTs, our public health nurses who will be administering vaccine, and other critical frontline workforce. We believe that this is the first of a regular weekly shipment of vaccine, but we do not yet have confirmation on the frequency or on the number of doses of vaccine that we will receive. You can see some photos from this morning and some pretty happy faces there as one of our public health care nurses unpacked the vaccine to put it into the freezer. So for anyone who's interested in learning more about the safety and the efficacy of the COVID-19 vaccine, you can visit montcopa.org/COVID-19 and click on the vaccine information button, which is now located at the top of the page. While having vaccine allows us to fight this virus head on, we must continue to play defense. It will be a number of months before we have enough vaccine to vaccinate the general population. As a community, we remain in this fight together. The choices that each of us makes regarding our personal conduct, whether or not we wear a mask, attend private social gatherings over the holidays, or answer the phone when the contact tracer calls, impact all of us. For example, our Montgomery County hospitals continue to have more patients hospitalized with COVID-19 now than they did in the spring. While there has been a reduction in the total number of hospitalizations since last week, some of our area hospitals remain near capacity limits. All of our hospitals continue to be impacted by staff who've been exposed or infected in the community due to the substantial amount of virus circulating right now. Our hospitals are going to extraordinary lengths to properly and safely staff the beds that are currently open. We need to work together as a community to reduce the spread of virus throughout our community to help protect our hospital staff. Each of us has the power to improve this situation by making choices that will reduce the spread of virus. Please keep the following facts in mind. The CDC has determined that over 50% of transmission of the coronavirus is by people with no symptoms. The virus is transmitted predominantly by respiratory droplets generated when people cough, sneeze, sing, talk, or breathe. Multi-layer cloth masks that do not have a valve can block 50 to 70% of these respiratory droplets. Consistently wearing cloth masks and maintaining 6 feet of distance from anyone who's not part of your household, whether you're indoors or outdoors, will have a big impact on reducing spread and protecting you and your family. Avoid social gatherings with people outside of your home. Our Office of Public Health has pulled together guidance on low, medium, and high-risk activities for the holidays. Please do everything that you can to stay in that low-risk category. You can find that guidance by going to montcopa.org/COVID-19. Click on the Reopening Guidance button at the top of the page. Then you'll see a drop-down menu, and within that menu, click on County Resources. If you can work at home, please do. Avoid carpools if possible. Keep your hands clean and away from your face. Get tested if you need to or want to, particularly if you are thinking about traveling over the holidays or have returned from a trip. And cooperate with contact tracing if you get called. Since our December 15th press release, we have 361 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 30,446. These positive cases are a result of a positive test for the virus, not from the antibody test. Today, 14 of these cases are from long-term care facilities, 49 from the Montgomery County Correctional Facility, 4 from other congregate settings, and 294 from the community. 346 of these tests are from the last 7 days or less, 8 tests are from 8 to 14 days ago, and 3 tests are from more than 14 days ago, and 4 have an unknown date. These positive individuals are from 55 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 1-year-old to 98 years old. And as always, you can check our county maps at mocopa.org/COVID-19 for updated geographic information. Today, we have 158 females and 203 males. I am sorry to confirm that 5 additional Montgomery County residents have lost their life to COVID-19, which brings us to 973 deaths confirmed positive from COVID-19. This is an increase of 31 deaths since last Wednesday. All 5 of the individuals today died in a hospital. They ranged in age from 63 to 85. Overall, 511 females and 462 males have lost their lives to COVID-19 in the county. They have ranged in age from 34 years old to 104. In terms of racial breakdown, where we have it, we have 1 American Indian or Alaska Native, 24 Asian, 5 Asian Indian, 4 Asian Korean, 119 African American or Black, 442 white, and 378 unknown. Update on our Montgomery County Correctional Facility. Since September, we have routinely had new commits to the correctional facility who tested positive for COVID-19. These individuals go through a strict isolation protocol and retesting before being moved into the general population. However, in the past 2 weeks, the correctional facility has had a number of staff and individuals in the general inmate population test positive for COVID-19. Last Thursday, December 17th, and Friday, December 18th, the 4th round of facility-wide testing for COVID-19 was conducted. All staff and inmates who had not previously tested positive or already been recently retested were tested. So I'm going to give you the totals for testing from December the 7th to December the 18th. It's been over this 2-week period that we've seen this increase in cases. So in terms of the total number of inmates tested between December the 7th and December the 18th, that number is 716. And of those 716, 90 individuals tested positive. In terms of staff tested between December the 7th and December the 18th, we've tested 287 staff, and 51 of those individuals have tested positive. Currently, all inmates who have tested positive for COVID-19 are in isolation and are stable without any symptoms. Just as a reminder, since the President Judge issued the initial March 12, 2020 order declaring a judicial emergency, the population in the Montgomery County Correctional Facility has gone from 1,342 to 797 today, a net decrease of 545, which is a 41% decrease. So I'm going to add into my weekly briefings now a vaccine update, which is really just so exciting to be able to have an update like that to give. So according to the Pennsylvania Department of Health website, as of yesterday, 7,800 doses of vaccine has been delivered to Montgomery County hospitals. As I mentioned earlier, the county received, just for our own use, 2,000 doses today. And I am aware that some of our hospitals also received additional doses today. I've been told that vaccination will begin at long-term care facilities next week, through a contract between the federal government and CVS and Walgreens. I'm hoping that eventually, as the number of vaccines given gets recorded in the state system, and this is a new system that we haven't talked about before. It's an old system, but we haven't talked about it before in these briefings. It's the Pennsylvania Statewide Immunization Information System, known as PASIS, that's SIIS. Hopefully they will begin to make public through that system the number of people that have actually been vaccinated in our county. Now, this information will be a little different than the information that we've been giving you around positive cases, because this information won't necessarily be tied to the residence of the individual vaccinated. It may be tied to the county in which they work. For instance, if they work at a hospital in Montgomery County and were vaccinated in Montgomery County. So it won't be quite the same as what we've been sharing with you around test results all of these weeks, but it should serve to give the public a general idea of how many people have been vaccinated. So moving on to our positivity rate, more good news. Our positivity rate has ticked downward this week. Yay, it's been a while. Our 14-day average positivity rate is now 10.93% as of last Friday, December the 18th, compared with 11.1% as of Friday, December the 11th. And you can see our 14-day positivity graph here. As a reminder, that orange jaggedy line are the number of people that were tested on any given day. And then the blue line is the 14-day running average of positive tests. So you can see that we are leveling off kind of in that 10% range. As a reminder, a positivity rate below 5% is considered suppression of the virus. And this graph shows the daily positivity rates from December the 5th to December the 18th. And of course shows that the county is well above 5%, which is that red line on all 14 of these days. But I think you can see there's a general downward trend in those daily positivity numbers. And so I'm hoping that we can get through these next two holidays without that just ticking back up again. As I mentioned earlier, our hospitalizations continue to remain high, but have improved since last Wednesday. Today, 464 individuals with COVID-19 are hospitalized in a Montgomery County hospital. This is decreased from 537 last Wednesday. We did hit into the 550s later last week after last Wednesday's press briefing. So we are down, almost 100 people from that particular peak. 11% or 51 of these individuals are requiring a ventilator. As a reminder, we have this information on daily hospitalizations and ventilator use on our data hub at montcopa.org/COVID-19, and it's updated every day, Monday through Friday. For the 14-day period ending December the 18th, 59,959 Montgomery County residents were tested for COVID-19. This is a decrease of 2,246 people tested compared with the 14-day period ending on December 11th. So that will take us to our date tested graph. As you recall, the gray bars are the number of positive cases on the given day. The red line is the total cases with a 7-day running average. The pink line is the total cases for the 14-day average. The dark blue are the cases just from the community for a 7-day average. The light blue is the community 14-day average. And then way down at the bottom are the orange and yellow lines are our long-term care facility 7 and 14-day averages. Next, we'll zoom in on the last month or so, just to help serve as a reminder of the impact of the Halloween and Thanksgiving holidays, during which there were many private social gatherings. You can see the uptick following Halloween. Then just as that surge started to level off, we hit the Thanksgiving holiday weekend. And we've been experiencing an unprecedented surge of cases since Thanksgiving, but thankfully are leveling off from that. I want to point out that while we're leveling off, our new baseline is approximately 370 cases per day. So compared to where we were even in early October, this is a substantial increase that we are leveling off at. And this number of cases per day places a significant burden on our hospitals and first responders, and will decrease the chances of our schools having enough staff available to offer in-person education. As you make plans for the upcoming Christmas and New Year's holidays, please consider the impact that Halloween and Thanksgiving have had on our community. The safest strategy is to celebrate only with the people in your household. I do remind you, as we are in yet another set of holidays where we are asking you to make sacrifices, that there is light at the end of this tunnel. The vaccine is arriving, and we will start to vaccinate our critical frontline workers like EMTs and paramedics next week. This will be followed by home care workers, community-based doctors and providers, then grocery store workers and teachers, police and firefighters, and other essential frontline workers in our community. In a few short months, there will be safe and effective vaccine available for our entire community, but we need to hunker down between now and then to protect our first responders and hospitals, protect our teachers, the staff, and the school bus drivers working in the district whose school boards are choosing to offer in-person education, and to support those businesses that are operating safely, are following the mitigation measures, and are not known sites of COVID transmission. We want them to continue to be able to operate. So that brings me to contact tracing. Again, because of the large volume of cases, the contact tracing team continues to prioritize contact tracing in the following ways. We prioritize persons that are 18 years of age and younger. This is to help support our schools, people that are 65 years and older, and persons that are part of a community or household cluster. As a reminder, if you're exposed at a school, through a sports team, or at your workplace and need to quarantine, your initial contact from the contact tracing team is now likely to be by email rather than a phone call. So if you believe you may have been exposed through one of these locations, please check your email regularly. We continue to have good availability of testing, and I want to urge anyone who wants or needs to be tested to get tested. We will have a holiday schedule in place over these next 2 weeks. Tomorrow, Christmas Eve, Thursday, December the 24th, all sites will be open for the limited hours of 9 a.m. to 2 p.m. So we'll be closing early tomorrow at 2 p.m. On Christmas, Friday, December the 25th, all testing sites will be closed. Saturday, December the 26th, our Ardmore location will be open from 9 a.m. to 1 p.m. and appointments will open online Friday evening at 7 p.m. at montcopa.org/COVID-19 by clicking on the County Testing Information button at the top of that page. Next weekend, the schedule will be pretty much a mirror image. New Year's Eve, Thursday, December the 31st, all sites will be open from 9 to 2. New Year's Day, all sites will be closed. And then on Saturday, January the 2nd, the Pottstown location will be open from 9 a.m. to 1 p.m. And again, appointments will open online Friday evening at 7 p.m. As a reminder, if you know that you've been exposed to COVID-19, you should self-quarantine. If you would like to be tested, you need to wait 5 days since the exposure. Getting tested more quickly than that will not be reliable. If you test negative after 5 days, have not had any symptoms, and have not had any ongoing exposure to someone with COVID-19, your quarantine ends on the 8th day after exposure. Just again, a reminder that in addition to being able to register online for the test, you can register by phone. That opens up at 8:30 in the morning, Monday through Friday at 610-970 2937. Language line is available at that phone number. And the online registration opens each day, Monday through Friday at 7 a.m. at moncopa.org/COVID-19. Click on the green County Testing Information button. So we remain in a serious and continually evolving situation. Together, we have the power to keep this virus in check while we await the arrival of enough vaccine in our community to vaccinate everyone who would like to be vaccinated. It's good news. We're moving in the right direction, and we are finally at the beginning of the end of this pandemic. And with that, I will turn over to Commissioner Lawrence.
Thank you, Val. I have 3 announcements for our business community today. We know that our restaurants are really struggling to stay open right now without in-person dining and missing holiday parties. We miss gathering at these places to share special times with our family and friends. And we certainly do encourage you to support our restaurant industry with takeout during these times. We recognize the importance of the restaurant industry as a cornerstone of Montgomery County's economic and workforce development, as well as central to the growth of entrepreneurship, job opportunities in our communities. So that's why I'm pleased to announce again that the Montgomery County Board of Commissioners has made available an additional $5 million in county economic development funds to support restaurants and other food services businesses. Applications for the Monco Strong 2021 Restaurant Grant Program will open on Wednesday, December 30th, and will close on Wednesday, January 6th, 2021. These awards are not given on a first come, first served basis, so you have time to get in your application. Grants of $10,000 will be awarded to each qualifying business. This program is being jointly administered by the Montgomery County Commerce Department and the Redevelopment Authority of Montgomery County. We encourage Montgomery County restaurants and other food service businesses in need of support to look into this latest round of funding and apply. Applicants with questions can submit them through the Commerce Department's Assistance Request Form and get more information, including the program guidelines, at www.moncopa.org/commerce. In previous rounds this year, Montgomery County has awarded nearly $20 million to help small businesses and nonprofits struggling due to the impact of COVID-19. We have also, I have an announcement about our small business PPE distribution program. We have new partners there. Earlier this year, to help Montgomery County small businesses impacted by COVID-19, the Board of Commissioners approved the purchase of 12,000 personal protective equipment kits for distribution to small businesses throughout the county. This initiative is a collaborative effort between the Montgomery County Commerce Department and the Office of Public Health in partnership with the newly formed Alliance of Montgomery County Chambers of Commerce, and it began in October and will continue into the new year. The Alliance of Chambers is a collaboration of local chambers serving businesses in Montgomery County. So today I'm happy to announce that we've added some new distribution partners who can help us reach even more businesses. And they are the Mainline Chamber of Commerce, the Valley Forge Tourism and Convention Board, the Montgomery County LGBT Business Council, ACLAMO, the Korean American Association of Greater Philadelphia, and then some of our municipalities are helping out as well. Conshohocken Borough, Worcester Township, Springfield Township, Bridgeport Borough, Jenkintown Borough, Horsham Township, Swanksville, and Upper Marion. We're committed to helping as many businesses, families, and industries as possible to stay open and during this pandemic. The kits include face mask, face shields, sanitizer, a thermometer, and other crucial COVID-19 mitigation and protective equipment, along with the Mask Up Monco window clings and documents that provide COVID-19 information and guidance. CARES Act funding received by Montgomery County financed these kits. PPE is vital for businesses, their employees, and their customers and visitors. Providing these supplies to small businesses saves them time and money they'd otherwise use to procure PPE and allows them to do what they do best and keep their businesses going. The Alliance and other community members, which I announced, will be distributing the no-cost kits to any small business that requests them. Businesses with 100 or fewer employees will be eligible for 7 kits based on total employees while supplies last. And I'd just like to recognize the original members of the Alliance, the Eastern Montgomery County Chamber of Commerce, the Hatfield Chamber of Commerce, Indian Valley Chamber of Commerce, Montgomery County Chamber of Commerce, Norristown Chamber of Commerce, Perkiomen Valley Chamber of Commerce, Springford Chamber of Commerce, the Chamber of Commerce for Greater Montgomery County, and the Tri-County Area Chamber of Commerce. For any businesses interested in getting a kit, they can request one from their local participating Chamber of Commerce or municipality, or they can go to www.montcopa.org/commerce and fill out the Commerce Department Assistance Request Form. And our Commerce Department will connect you with the distribution partner. And for any municipalities who are interested in participating, please contact our Commerce Director, Dave Zellers, at dzellers, DZELLERS, at montcopa.org. And finally, not related to COVID, but also which may be of interest to our business community, on December 21st, the U.S. Small Business Administration, SBA, announced that low-interest disaster loans will be available for Montgomery County residents, businesses, and nonprofits affected by Tropical Storm Isaias on August 4th. Business physical disaster loans, economic injury disaster loans, and home disaster loans are all available. Applicants may apply online using the electronic loan application via the SBA secure website at disasterloan.sba.gov. And businesses and individuals may also obtain information and loan applications by calling the SBA's Customer Service Center at 1-800-659-2955 or by emailing disastercustomerservice@sba.gov. The filing deadline to return applications for physical property damage is February 16th, 2021. And the deadline to return economic injury applications is September 20th, 2021. And that concludes my update, Val.
Great. Thank you. So with that, I will announce that our next virtual briefing will be next Wednesday, December the 30th. And Commissioner Lawrence and I would be happy to take questions.
We'll start our questions this afternoon with Carl Hessler from the Pottstown Mercury.
Good afternoon, Commissioners.
Afternoon.
You mentioned a few numbers of vaccine numbers, and I just wanted to get a clarification on that. You said 2,000 doses from Moderna you received today.
Yeah, to the county.
To the county. And that's coming from the state, correct? The state is divvying that out.
Correct.
Okay. And then you mentioned a 7,800 number.
Yes.
Is the 2,000 incorporated into that 7,800 number?
It is not. The 2,000 is separate. So
Okay.
the 7,800 doses is the total of doses that have gone directly to Montgomery County hospitals as of yesterday.
And that would be the Pfizer. Was that the Pfizer vaccine?
Well, it's mostly Pfizer. Although today I had my regular hospital call today, and at least one of them got some Moderna vaccine.
Okay. Will the county continue to receive Pfizer vaccines as they become available also in future weeks?
I don't have an answer for that. We will take whatever we can get. We are prepared to receive both vaccines, and we will not turn anything down. So we've been told that we will get a weekly distribution, but we haven't gotten confirmation of that yet.
Okay. And when the time comes to deliver the vaccines to the long-term care facilities, who decides which long-term care facilities in the county will get those initial doses? And does the county health department have any input in making that decision?
The county health department does not have any input into that decision. That is being done through a contract between the federal government and CVS and Walgreens for that particular distribution. So we don't have input into the order of facilities under which that vaccination will take place.
Okay, and have you gotten any update on when staff and prisoners at the county jail would be eligible to receive vaccine?
So correctional officers are considered in the 1B population, and we are discussing internally where we will put inmates in terms of that prioritization.
And would that be a decision of the county, or would the state have to approve that?
That answer is not clear to us yet.
Okay. Okay, that's all I have today. Thank you.
Thank you.
Next, we'll go to Jim Melward from KYW.
Kind of dancing around some of Carl's questions. You mentioned the CVS Walgreens program that works with the nursing homes. How much does the county have to do with anyone over 75 who's not in a home but has health conditions? Does the county have anything to do with helping them coordinate a vaccine?
Yeah. So you're probably referring to the fact that the ACIP recommended over the weekend that individuals who are 75 years of age and older go into the 1B prioritization group. Currently, we're using the guidance of the Pennsylvania Department of Health, which has not altered their guidance yet. And so we don't know yet if they are also going to concur with that in terms of moving just globally all 75 individuals that are 75 years of age and older into that higher prioritization. So we'll wait to see what they say. But as a general comment, for any person who's 75 years of age or older and living in the community, so not in a long-term care facility, then we would work to vaccinate them as we get sufficient vaccine available to do so. Dr.
Levine did update today saying that they got the information yesterday from one of the acronyms you guys love so much. I'm not even going to try to come up with it. So she did say that they have changed the 1B, 1A, 1B, 1C. But anyway.
Thanks. You're a press briefing ahead of me, so that's good to know.
I thought I had a path, and then it disappeared, and I just realized I was rambling incoherently. What you talked about EMS and how does that work? And I'm not really great at EMS, and you know who gets it through the county, who would get it through a hospital. Are there different groups that would get it in different ways?
There are. So some EMS units are affiliated with a hospital. I think in some cases, I don't know if that's true in this county, but in some cases, I think they're actually employed by some hospitals. For the most part in Montgomery County, our EMS and paramedic units are independent. And so we have lists of them. Dr. Al Wong is our regional EMS director, and they are actively reaching out to all of them to let them know that there will be this opportunity to be vaccinated next week.
And is it up then to, say, whatever EMS, is it up to them to figure out who is priority, or do you guys tell them kind of who should get it first?
Well, when it comes to EMS units, they are of equal priority. So we would urge them to send their entire unit to be vaccinated.
And looking at the graph that you showed, there was a dip before Thanksgiving, before cases went back up. Does that concern you as we go into another holiday like Thanksgiving, seeing that possible dip?
Well, we're actually, I would say, seeing that dip right now as we head into the Christmas holiday. And again, it's exactly what happened after Halloween and before Thanksgiving. We got to a leveling off from that Halloween surge. And although there was a small dip, I mean, it is not terribly meaningful. And then we saw a big surge after Thanksgiving. Similarly, we're starting to see the leveling off from Thanksgiving, but we are leveling off at a very high number of cases, on average about 360, 370 cases a day. And it was just 6-7 weeks ago that we had an average of, 30, 35 cases a day. So this is a considerable increase in terms of a new baseline. And all of our hospitals are very concerned about any surge on top of what is already a very high number of daily cases, some percentage of which do get hospitalized. So I just want to urge people to do everything they can to stay safe over these next couple of holidays and celebrate just with people in their home, in their household.
And just looking at my notes, just to make sure I have this and understand it, for people who are over 75 in nursing homes, that will be handled by the federal cooperation with CVS and Walgreens. People, what should people who are 75 and not in a home or family members, what should they be looking for, or who should they be talking to make sure that they can get vaccinated when it's their turn?
Yeah. So the county will be publicizing all of that information as soon as we have enough vaccine to start reaching out to that group. We will make that public through press releases, through press briefings like this, through our social media accounts. And we'll be doing outreach, I'm sure, through our Office of Senior Services and all the mechanisms that we have to reach that population.
So things might be foggy right now, but as they become more clear, you guys will make sure that information is getting out there to the people who need to get it.
Absolutely. The thing that we need right now is vaccine. And so until we have a clear understanding of what we can expect to receive and how frequently we can expect to receive it, it's very difficult to make a plan.
Great. Thanks.
Thanks, Jim. That concludes our questions for today.
Okay, great. Well, thank you so much, everybody. And if you celebrate Christmas, have a very Merry Christmas. And we will see you next week. Thank you, Megan.